So hello everyone. So today we have the second part of the one of the last cases, right?
Yes, it was 4 weeks ago.
So 4 weeks ago, I made a publication about if lamps was still necessary. Okay, so we made that moment. I made drainage of the gallbladder through the body of the gallbladder, right? So today we retake the patient. This patient is under evaluation, in a study that we are conducting here about, the treatment comparing surgery, laparoscopic surgery versus endoscopic treatment. So what we are seeing now is that we are inside the gallbladder. You can see now. So
Yes.
Juan Manuel already removed all the stones, and you can see all this is
Inf-
an
i-
inflammatory area of the gallbladder, and this is fibrotic tissue because of this is a chronic cholecystitis. But
yes, that's
there is already fibrotic tissue alteration that you can see there. You see, like scars, like ulcer scars. So this is very important. This is something
million.
that we didn't recognize normally, okay? Because this
Well.
is like new for us, for every one of us to see with a camera inside and see the alteration of the surface. You can see because of the stones, all this inflammation has been performed. So the protocol that we are using here is a new protocol to evaluate if endoscopically we can treat this kind of patients. And we need to see what happened with chronic cholecystitis, what we need to see what happened with acute cholecystitis, for example, and what is the best option in terms to determine if one patient needs surgery or not. That is one of the key points also from the study. But now, Juan Manuel finished completely. He removed all the stones with a basket, right? And right now
Right
we
now,
will we will pass.
I am entering into the gallbladder through the bulb, and the idea is to perform a
Cholangiogram.
cholangiogram
Yes.
to see if there is any stone inside the cystic duct or maybe in the biliary tract. Remember, it's important to when you perform this kind of procedure, it's important to already have a ERCP because some stones can go to the common bile duct. So it's important. In this case, we already performed an ERCP few weeks ago and put an biliary stent, as you can see there in the fluoroscopy. Now I will inject contrast, and you can see there the gallbladder. All the gallbladder is filled with
And you can see the
contrast,
cholangiogram.
and the cholangiogram is okay. Now you see it.
So you can see very well the cholangiogram. I don't see any stone. We need to remove the stent. We need to clean up because there were micro lithiasis. This patient had I don't remember if she had pancreatitis or something like that, but
Just cholecystitis.
just cholecystitis, right? So now you can see she's very well. She's in a good situation. It means the treatment was fantastic. She went home. Now she's ambulatory right now. And now we will take biopsies from these areas. I need to take different location biopsies because I need to understand what is going on in the gallbladder in general, right? So we will take biopsies from these inflammatory areas, from the ulcers, scars. This is important, and we are using a pediatric forceps biopsy. So in this way, we are doing exactly what the surgeons are doing, right? When they do laparoscopic remove of the gallbladder, uh, when they do that, normally they make a cholangiogram during the procedure. So and then they send to the pathologist, the gallbladder to evaluate what is going on with the gallbladder in general. But here we are trying to be very
A ver,
specific. It means
cierra.
we are trying to see and detect the specific areas where is inflammatory and also where is some areas of fibrotic tissue to understand a little
Cierra.
bit, but microscopically it appears that it is a chronic inflammation for sure because of the stones. And we need to see what happened, in the follow-up in terms of there is any recurrence of cholecystitis, even if we make this treatment, and also to use ursodeoxycholic acid in the follow-up to see, if the patients does well, because one of the problem of surgery or laparoscopic surgery is not that I am, uh, not in accordance. I am in accordance to the surgery, but what we have in normally is that many patients, at least 20 to 30%, can perform a post-cholecystectomy syndrome. It means a lot of bloating and diarrhea and a lot of things that
Yes.
normally
Yeah,
after
it's,
6 months can, improve, but many of them didn't improve with the time. So this is very important to understand a little bit more and to see what kind of therapeutic alternative we can do to these patients. I don't know what Juan Manuel think about this.
yes, I think the same way that that you are talking, because the idea is try to don't to remove the gallbladder. Okay, I think it's an organ that even we can live without gallbladder, but sometimes it's useful to 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 perform a good digestion of all the meals, all everything. So it's important that we have a gallbladder. Try to keep it. So that's why I think this is a very important kind
Yeah, the thing we
of
need
procedure.
to, yeah,
So
we need
we need to evaluate and see
to
what
evaluate
happened.
if it is okay. Maybe chronic cholecystitis probably needs surgery for sure. Maybe, I don't know what will be the results, but and maybe not. It will depend on the statistical results that we are taking. So this is the second year of the study, right?
Yes.
So it's this start as a, as a small question about, if we needed um the lamps. I believe we will need lamps for sure. So we need that they improve. That is fantastic and is good. But at the same time, you know, are necessary? No, we can do. You see the treatment. We can do it.
Just with a fully covered
Yes,
stand. That
fully covered stand. A small stand that I put it. I will put also, in the LinkedIn also and also in the history, the other case, so you can see the first part and now the second part that was perfectly performed by Dr. Juan Manuel Alcivar, Professor Alcivar, from Spain, Sevilla. Take más fotos digo, biopsias de las zonas de cicatriciales.
yeah.
So I need to see the scar areas and dejémosles un pigtail. I will less double pigtail because I want to come up en 3 meses para revisar cómo
Yes, to
está,
see
si
the
mejoró la inflamación o no.
information. Okay.
We want to see in 3 months if inflammations improve. So we will less double pigtail there just to keep the fistula still there and to don't need to perform another, anastomosis, right? So Juan, we will take a few more biopsies and we will less the stand. So I will come back with you in another
Alright.
case. Thank you so
Cierra.
much
Cierra.
for following
Alright.
us and join us
Cierra.
during the DW this year and during ESG days, okay?
Cierra.